Okay, so first I would like to give an answer for what I do in a residential school. Fine. So I think, as we all know, the residential school definition is where the kids or the students, they just stay and they do perform all sort of activity, whether it is a sports or it is any kind of extracurricular or academics activity. Fine. So when they play a sport, of course, some of them are the beginners, some of them they play in a state or national level, and some are the exceptions. Even they do represent India at the international level, right? So when they play a sports, they do met an accident, they do collide to each other. If they, especially when they are playing the contact sports, there are fair chances that they injured themselves or they injured their colleague. Fine. So what I do, I first of all I do prevention activity. So there are certain protocol. In my scenario, I do follow the ECSM protocols, which actually take care of treatment, which take care of the prevention and then restoration of an athlete. Fine, at every level. So it's in a residential school. We do have a very good exposure over here. So I basically spend a lot of time with the kids. I do teach them how to play. First of all, how to become skillful, and then secondly, if at all if they met in any accident and they get any injury, the injury can be a simple bruises, or it may be a big as concussion, or it may be a spinal injury, or any orthopedic injury like a trauma to their bones or their muscles or tendon. So accordingly, the up to the extent of the injury, we do treat them. Fine. And yes, of course, if you want to know about the prevention, there are certain kind of protective equipments. Like I think you would have seen how the cricket players do play the cricket. They do a lot of padding on their knee area. They use their hats. They use their gloves. So for every particular sport, there are some particular protective equipment, so they have to play. And of course, if they are in their some certain level, if they are skillful, then there are lesser chances of getting the sports injury. Fine. Once they get the injury, treatment is done. Now the my main role begins. I have to restore that person, that athlete or the student, up to the level where that person was playing before, or sometime even better. Suppose if I have a person who met an accident and now he or she is having some sports event which is coming in 6 months, but the injury was so bad. I think you all would must be aware of the case of Rishabh Pant, where he